Let's earn ENT. To actually learn ENT, like never before. Hello and welcome back to another episode of ENT by Dr. Pranshu Mehta. Today we'll be dealing with the middle ear anatomy. So, for learning and understanding middle ear anatomy, just assume a box with four walls, one roof, and one floor. Now, whenever I'll say middle ear cleft, we'll be talking about the middle ear along with the eustachian tube and the masseter antrum. So, just like a room, we'll have six walls to deal with. Four walls. A means the anterior wall, then R is the roof, L is the lateral wall, P is the posterior wall, M for medial wall, and the below one is the floor. Okay, so we have discussed that there are six walls: anterior, posterior, medial, lateral, roof, and the floor. Now, what is important is when we see through the ear canal, what we observe is the tympanic membrane. Now, tympanic membrane is nothing but a kind of a window on the lateral wall of the middle ear. So, you are not actually seeing the complete lateral wall, you are just seeing a part of the lateral wall, that is the tympanic membrane, that is like a window in the room. Now, whatever space of the middle ear you can see through that window is what we term as the mesotympanum. Mesotympanum. Now, the space which we cannot see, which lies above this part, is what we call as the epitympanum. And the space which lies below the mesotympanum, again which we cannot see, is the hypotympanum. Now, the area near the eustachian tube opening we can call it separately as the protympanum, whereas the area posteriorly located where there is a pyramid, we can call it the retrotympanum. So what we have done is we have divided the middle ear space into few spaces: the mesotympanum, above it the epitympanum, and below that the hypotympanum, and we have termed separately two spaces, the protympanum and the retrotympanum. Now imagine yourself to be sitting inside the middle ear. Imagine you are sitting in the right middle ear of your body right now. So what lies in front of you is the anterior wall. I'll write it down for you. A, the anterior wall. Now, towards your right will be the lateral wall. If you are in the right side, towards your right will be the lateral wall on which we have the tympanic membrane. Then towards your left will be the medial wall. Above you will be the roof, below will be the floor. So these are the things which you can see: anterior wall, lateral wall, medial wall, roof, and floor. So let's see what structures lie on the anterior wall. I am making two canals, as you can see, one above the other. Both will lie medially. First, the canal which lies above is the canal for the tensor tympani muscle. Yes, the tensor tympani muscle, which is attached to the malleus, which will increase the tension in the ossicular chain, is actually originates from the anterior wall. It has a canal. Then just below it lies a canal, which is the canal for the eustachian tube, the bony part of the eustachian tube. Now, these two things or these two openings lie in the anterior wall of the middle ear. Now, let's just turn a bit left to see what lies on the medial wall of the middle ear. Now we have seen what lies on the anterior wall. Now let's turn towards the medial wall. Okay. Now as you can see, now we are facing the medial wall. Now when you are facing the medial wall, towards your right will be the anterior wall, towards your left will be the posterior wall. As we have seen, anterior wall we have already made two openings: the tensor tympani muscle canal, and below that eustachian tube canal. Okay. Now let's focus on the medial wall. On the medial wall, what we can see, there is a bulge or embossment, which is due to the bulging caused by the basal turn of the cochlea. This bulge we call as the promontory. So promontory is nothing but the bulge in the middle ear medial wall due to basal turn of coil of cochlea. Now, behind this promontory, posterior superiorly and posterior inferiorly, there are two fenestra. The one which is posterior superior is the oval window, and one which is posterior inferior, this is the oval window. As you can see, posterior superior, this is the oval window, and the one which is below, which is posterior inferior, is the round window. So we have two fenestrations. Now we have other names also for these fenestrations. The oval window is also called as fenestra vestibuli. Fenestra vestibuli. and the one which is the round window is also known as fenestra cochleae. Fenestra cochleae. Okay, so these are the two openings. So on medial wall we have seen there is a promontory. Just posterior superior to it lies the oval window, and posterior inferior to it lies the round window. Now if you see above the promontory, there is a horizontal bony canal. It is exactly horizontal. So there is a horizontal bony canal which houses the facial nerve. Which part of the facial nerve? Actually, which segment? The horizontal segment. So there is a horizontal bony canal for the facial nerve which runs above the promontory on the medial wall of the middle ear. So the structures which we have seen till now are the promontory, the round window, the oval window, and the facial nerve, the horizontal part of the facial nerve. Now let's move to the posterior wall of the middle ear cavity. The posterior wall of the middle ear. So we have seen that on the medial wall on the right there is promontory, oval window, then posterior inferiorly the round window, then the facial nerve in its horizontal part. Laterally we have tympanic membrane. Now talking about the posterior wall, there is a very important prominence called as the pyramidal prominence. Now this pyramidal prominence, I'm drawing it over here because I cannot show the 3D structure over there. The pyramidal eminence gives attachment to the stapedius muscle tendon. Yes, the stapedius muscle, which is connected from this pyramidal eminence to the stapes. Now if you follow the facial nerve on the medial wall, which was horizontal over there, it becomes vertical. It bends and becomes vertical to pass behind this posterior wall to exit this temporal bone through the stylomastoid foramen later. Now see this horizontal canal, the facial nerve from the horizontal canal becomes vertical and lies behind, or deep you can say, it lies behind the pyramidal eminence in the posterior wall of the middle ear. So this is the vertical part of the facial nerve. Now in this vertical part, the vertical part of facial nerve gives off a branch. One branch directly to the stapedius muscle, that is muscular branch, and the other branch which is responsible for taste, the chorda tympani. Now if we look above these structures on the posterior wall, there is an opening. Now this opening communicates with the mastoid antrum which is located posterior to the middle ear. Okay, so this opening is what we call as the aretus. Now this aretus, if blocked, prevents the aeration of the mastoid antrum leading to its diseases. Okay, so just medial to the aretus we have the bulge of the lateral semicircular canal. It lies just medial to the aretus and posterior superior to the facial nerve. This is the horizontal semicircular canal. Okay, now we'll talk about some important spaces which lie on the posterior wall. I am making a bony ridge between the promontory or the medial wall of the middle ear extending till the pyramid, and this one below extending from the medial wall of the middle ear or the promontory till almost the lateral wall. So the first one above, which lies above between the pyramidal eminence and the promontory, is called as the ponticulus. This bony ridge is called as the ponticulus. The second bony ridge, which is below, is called the subiculum. Now if you see, these structures encircle an area. This is a depression actually. This depression is also called as the sinus tympani. It is guarded laterally by the pyramid or the pyramidal eminence, superiorly by ponticulus, then medially by the promontory, and inferiorly by the subiculum. So this area, this is called as the sinus tympani. This is the most common area for recurrence of the cholesteatoma, because this is the area which is one of the hidden areas of middle ear. We cannot completely see or access this area. Now the other area or the recess is this, the facial recess. Superiorly it is bound by the aretus, laterally it is bound by the chorda tympani, and medially, as we can see, it's bound by the pyramid or the pyramidal eminence. This is the space which is called as the facial recess, and this is the space which we open when we perform the posterior tympanotomy, approach to access the tympanum or the tympanic cavity via the posterior route. Now, as we all know, there are ossicles situated in the middle ear. Now, talking about the ossicles, this is the head of the malleus. I'm drawing the malleus. Now, this is the anterior process which I have drawn. This is the neck, this is lateral process, this is the handle of the malleus, and at the edge of the handle we have the umbo. Well, it articulates with the incus. Now this is the incus which I have drawn. Incus has a body, then it has a short process, then this is the short process, then we have a long process and the lenticular process. This one is the lenticular process which articulates with the stapes or the stapes. The stapes has a head, neck, two crura and foot plate. So this is the head, this is the neck, this is the foot plate, and these are the two crux or the crura or crus. This is the posterior one. As you can see, the posterior crus is a little thicker than the anterior crus, and anterior crus is can easily be fractured because it is thinner as compared to the posterior crus. Now these ossicles have two joints, the incudostapedial joint, this one which is a ball and socket kind of joint. Both are the synovial kind of joints, and the other one is the incudomalleolar or the incudomalleal joint. Okay, now let's see how are these oriented in the middle ear. So if considering again the right middle ear of your ear, this is how the ossicles are oriented. We can see this is the malleus, that is the head which lies above the mesotympanum. So the head lies in the epitympanum along with the body of the incus. This is the handle. So what you can see through the middle ear tympanic membrane is the lateral process, the handle and the umbo, then the long process of the incus, the lenticular process, sometimes the incudostapedial joint along with the oval window or the foot plate. That is what we can see through the mesotympanum. So okay, let's just make it again. The structures which are there or which lie in the mesotympanum in the ossicles, which we can see, like how we see when we examine a tympanic membrane, and suppose if there's a perforation, you can see the middle ear space. What you will see is the handle of the malleus with its umbo. Then you will be able to see the long process of the incus. See, this is the handle of the malleus, then the long process of the incus along with incudostapedial joint, whereas the head of the malleus and the body of the incus will lie in the epitympanum. As you can see, this will not be visible when you examine a tympanic membrane with even complete perforation, large central complete perforation. So what you will be able to see will be the handle of the malleus, the long process of the incus, the incudostapedial joint along with the foot plate. So these are the structures that will be visible to you in the mesotympanum. So these are the structures present or seen in the mesotympanum, and the head and the body along with the short process will lie in the epitympanum. Now let's talk about the relations of the middle ear. Imagine we are facing the medial wall. Medial wall, A is anterior, P is posterior, roof and floor. Anterior to the anterior wall lies internal carotid artery, the ICA, which has its surrounding sympathetic nerves or the fibers or the plexus of sympathetic nerves. Now it gives branches. The internal carotid artery gives caroticotympanic branches which come along with the sympathetic nerves through the anterior wall to enter the middle ear cavity. Now these nerves, which are sympathetic in nature, supply the tympanic plexus. This tympanic plexus is located on the medial wall of the middle ear, forming or just over the promontory. Okay, now talking about the roof. Superiorly, if we drill the roof, we'll find middle cranial fossa. So what we'll find actually is the middle cranial fossa dura. If we drill superiorly, so superiorly lies the middle cranial fossa. Now below the floor lies the jugular bulb. The jugular bulb, from where the internal jugular vein will start. That jugular bulb lies just below the middle ear. Now there is one cranial nerve, the cranial nerve number 9, which is known as the glossopharyngeal. It gives a branch. The branch name is Jacobson's nerve. This branch also gives parasympathetic fibers. Now see, sympathetic fibers came from the ICA, plexus around the ICA. Now the parasympathetic fibers come as the Jacobson's nerve through the glossopharyngeal to supply to the tympanic plexus, which lies on the medial wall of the middle ear over the promontory. Okay, now just medial to the middle ear's medial wall, we have the inner ear, where we have cochlea in front, then vestibule with semicircular canals. Posterior to the posterior wall, we know mastoid, the mastoid part of the temporal bone along with its mastoid antrum. Now this tympanic plexus gives off a branch which is known as the lesser petrosal nerve. This lesser petrosal nerve goes from the tympanic plexus and supplies the parotid gland. Okay, so let's revise everything which we have learned till now about the middle ear. Imagine we are sitting inside the right middle ear. Anteriorly we have the anterior wall, laterally lateral wall, to our left medial wall. Okay, so anterior wall we have two structures, two canals as we have read. First is the canal for tensor tympani muscle. Just below it is another bony canal for eustachian tube. Anterior to the anterior wall there is internal carotid artery. Okay, again we'll revise. Anteriorly on the anterior wall we have tensor tympani. Just below that we have canal for the eustachian tube. Okay, now talking about the medial wall of the middle ear, we have a bulge which is known as the promontory. This bulge is due to the basal coil or basal turn of the cochlea. Now we have posterior superior to it the oval window, and posterior inferior to it the round window. These are also known as fenestra vestibuli and fenestra cochleae respectively. If we see superior to that, we have a bony ridge which is horizontal, which houses the horizontal part of the facial nerve. Then just posterior superior to that we have a bulge for the lateral semicircular canal, which is shared by the posterior wall as well as the medial wall. Now on the posterior wall we have a pyramidal or a conical eminence known as the pyramid, which is attached to the stapedius muscle, attached to the tendon of the stapedius muscle. Now this pyramid actually gives attachment to two bony ridges. One bony ridge from the pyramid to the promontory, which is known as the ponticulus, and the bony ridge below it, which connects the promontory to the lateral wall, is called the subiculum. Now this area between these four structures is called the sinus tympani, which is lined by ponticulus above, subiculum below, pyramid laterally, and promontory medially. Now if you see just behind or deep to the pyramid, there is vertical part of the facial nerve. Then this facial nerve gives off a branch which is the chorda tympani. Above all there is editus, which is an opening which connects the middle ear cavity with the mastoid antrum. Now okay, so let's do a quick recap and repeat after me. On the anterior wall we have two openings, one for the tensor tympani muscle, just below it the eustachian tube opening on the anterior wall. Moving to the medial wall, we have promontory which is bulged because of the basal turn of the cochlea. Posterior superior to it we have oval window, posterior inferior to it we have the round window. Now on the medial wall, if we look up, we see a horizontal bony canal which houses the facial nerve, the horizontal part of the facial nerve. Now if we look on the posterior wall, we have a pyramidal eminence which gives attachment to stapedius muscle. Now if you see or follow the facial nerve, the horizontal part of the facial nerve becomes vertical to lie deep to the pyramidal eminence on the posterior wall. Now there is sinus tympani which lies medial to the pyramid, bounded below by the subiculum, above by the ponticulus, and medially by the promontory and laterally by the pyramidal eminence. This is the sinus tympani, which is the most common site for recurrence of cholesteatoma. Now this facial nerve, the vertical part gives off a branch which is the chorda tympani, and above all lies the opening or the connection of mastoid antrum and the middle ear, which is known as the editus. So here I've made three walls separately: the anterior wall with two openings, the above one for the canal for tensor tympani, the below one for the eustachian tube; the medial wall with a huge bulge called the promontory with oval window above and round window below, and above all the horizontal part of the facial nerve. Posterior superior to it, the bulge for the lateral semicircular canal. Now moving to the posterior wall, we have the pyramidal eminence. Now this gives attachment to the stapedius muscle tendon. Just behind or deep to the pyramidal eminence lies the vertical part of facial nerve, which gives off a branch known as the chorda tympani. This is a bony ridge. From the first bony ridge from the promontory to the pyramid is the ponticulus. The below one is the subiculum. The space bounded by pyramid laterally, promontory medially, superiorly by ponticulus, and inferiorly by subiculum is called as the sinus tympani. Now superiorly we have an opening which helps in communication of middle ear to the mastoid antrum, known as the edit. And this area marked by the white dots which I am making right now is what we call as the facial recess, which is bound superiorly by the editus, medially by the pyramid, laterally by the chorda tympani. This is the facial recess. Well, so this is what we have for today about the middle ear anatomy, but this is just for giving you one initial understanding. I'll be back with one more video about the middle ear In that, I'll be sitting inside the middle ear. I'll show you a 3D middle ear, which is a realistic middle ear, the real images, to make you understand how and where is our middle ear located, how are the structures in the middle ear, so that you develop a very good orientation of the middle ear anatomy. Well, this is for now. If you like the video, do like, share and subscribe before closing the doors of your brain.